Good day everyone, I am Kando Angelica Jemima, and for today, I'm going to talk about Rickettsiacea and Bartonellaceae family of bacteria. So we're going to define them, their morphology, their cultural characteristics, pathogenicity, diseases, treatment, and their preventions. So first, let's talk about Rickettsiacea. So the family Rickettsiacea is named so in honor of Howard Taylor Ricketts. So si Howard Taylor Ricketts isa siyang scientist na pinag-aaralan yung spotted fever na kinokos itong bacteria na to. Pero habang pinag-aaralan niya itong spotted fever is nagkaroon siya ng typhus fever that is also caused by this bacteria. Then, namatay siya dito. So, habang pinag-aaralan niya yung bacteria, is namatay siya dun sa mismong bacteria. So, these are gram-negative bacilli, obligate intracellular parasites, and are transmitted to humans by arthropods. So, gram-negative bacilli, so in rod shape sila at hindi sila nag-retain ng color violet. And also, they are obligate intracellular parasites. When we say obligate intracellular parasites is nabubuhay sila when they are inside the host and wala silang choice kundi mag-stay sa loob ng host kasi hindi sila mabubuhay outside the host because they are obligate intracellular parasites. So, they depend on the host para mabuhay sila. So, they are transmitted to humans by arthropods. So, when we say arthropods, we talk about the ticks, mites, fleas. Yun yung mga pwedeng makapag-transmit nito sa humans or kung saan natin siya pwedeng makuha. Next one is infections can manifest as rash, fever, and vasculitis. So, yung parang symptoms when you have the infections that is caused by Rickettsiacea, pwede kang magkaroon ng lagnat, pwede kang magkaroon ng rashes, and vasculitis. Vasculitis is the swollen of the blood vessels. They are grouped depending on clinical features, epidemiology, and some other characters such as cultural characters and vectors. So, they are grouped depending on clinical features. So, ano ba yung mga symptoms na binibigay nito or ano yung mga sakit na binibigay nila? Epidemiology is kung saan sila tumutubo, kung saan sila nagpapakita outside the body of a human or a host. And some other characters as their cultural characters, vectors, or paano sila natratransmit. Ganun. So, ito po yung picture ng Rickettsiacea under the microscope. Next is, we are now going to talk about the genera or genus or genera under the Rickettsiacea. So first is the Rickettsia. They are small, gram-negative, obligate intracellular bacteria. They are transmitted by arthropods and can cause typhus and spotted fever group diseases. So, etong Rickettsiacea ang parang isa sa pinakamahalaga or pinakakilala na genera sa family ng Rickettsiacea. So, they are small, also gram-negative, hindi sila nagre-retain ng color purple na from gram staining, obligate intracellular bacteria. So, they also depend on the host kasi if they are outside the host, is pwede silang mamatay. And they are very sensitive bacteria. They are transmitted by arthropods. So, as I've said earlier, mga ticks, mice, fleas, yun yung mga pwedeng makapagpatay or makapag-transfer sa kanila sa humans. And they cause typhus and spotted fever group diseases. So, yung kinokos nito is yung parang two big groups ng causes nitong nasakit na kinokos ni Rickettsiacea. So, later on, we're going to talk about typhus and spotted fever diseases. Next one is the Orientia. So, for those people na mahilig mag-hiking or mag-picnic tapos maggulong-gulong sa grasses, kailangan nilang pakinggan ito. Orientia, genus closely related to Rickettsia. So, it is yung parang pinsan ni genus na Rickettsia. Yung common or yung main species dito is si Orientia tsuchugamushi that can causes scrub typhus. So, itong Orientia can be transmitted by chigger mites. So, kanina, kaya sinabi ko yung mga taong mahilig mag-hike or mahilig silang magulong-gulong sa grasses. Yung chigger mites, they are super small. Super small sila na nagtatago dyan sa may sa mga grasses. And pag nakagat ka nung super small na yun, is pwede kang magkaroon ng scrub typhus. So, imagine mo na lang na yung parang super small na scrub na chigger mites is makakapag-cause sa'yo ng scrub typhus na pwede na we're going to talk about later. Next is the Coxiella, genera Coxiella. So this is the strong one in the genera of the Rickettsiacea. So Coxiella, unlike the other bacteria, unlike the other species of Rickettsiacea, this Coxiella is transmitted through aerosols or from the dust particles, ganyan. It includes C. borneti, siya yung main species or common species in this in genera Coxiella. The agent of Q fever, which is we're going to talk about later. They are highly resistant, survives in harsh environments. So, kung kanina, yung ibang bacteria is mabilis mamatay, itong si Coxiella, kaya niyang magstay or kaya niyang mag-survive into harsh environment. So, kahit na parang gumawa ka ng ways, makakahanap si Coxiella ng way para magstay. So, para siya yung parang toxic person na parang blinak mo na nga, pero meron pa rin siyang way para bumalik sa'yo at para guluhin ka at magbigay ng sakit. So, it is transmitted via aerosols or contaminated animal products. So, itong si Coxiella is, fun fact, na siya, nasusurvive niya yung pasteurization. So, yung contaminated animal products like milk is, pag nainom mo yun or na-ingest yun ng isang tao, is pwedeng magkaroon ng Q fever or ma-infect by the Coxiella bacteria. Next is the Ehrlichia. Ehrlichia is intracellular bacteria infecting blood cells. So, itong si Ehrlichia, siya yung target niya is your blood cells, especially the monocytes and the granulocytes. It is transmitted by ticks also. So, si Coxiella lang yung parang natatransmit through aerosols and can cause monocytic and granulocytic erlichiosis. Halos same lang si Ehrlichia, si Orientia, and si Rickettsia. Well, si Coxiella, siya yung parang naiiba sa kanilang apat. So, ito yung mga important species na kailangan natin tandaan in the family Rickettsiaceae. The R. Proboscis, R. typhi, R. rickettsii, R. conori, R. australis, R. siberica, and R. acari for Rickettsia, O. tsuchugamushi for Orientia, C. borneti for Coxiella, E. senetsu, E. schaffesins, E. Phagasotophila for Ehrlichia. Let's now proceed to the morphology of the Rickettsiaceae. So, Rickettsiaceae is a small, gram-negative, phleomorphic cocobacilli. So, ang phleomorphic cocobacilli, so they are between round or rod shape. Phleomorphic means it is depend on their conditions. Their size is about 0.3 to 1 to 2 micron. So, imagine yung dust particles, isikat mo pa yun sa 100. So, ganun sila kaliit. They are non-motile and non-capsulated. So, unlike other bacteria na parang they can move freely through their flagella and they can protect themselves through their capsules. Itong si Rickettsiaceae is wala siya. They are non-motile and non-capsulated. They do not stain well in gram stain, but they are visible under light microscope. And they are also visible pag na-i-stain sila on other staining method like the Giemsa, Gimenez, Castaneda, and Machiavello. But in those staining processes or staining method, may iba't iba silang color na kinukuha. So, in Castaneda and Gimenza, they stain them purple. While in Gimenez and Machiavello naman, they stain them red. So, their cell wall resembles gram-negative cell wall. So, like other bacteria na may gram-negative cell wall, is nakakompose sila ng lipopolysaccharides and thin peptidoglycan. Also, Rickettsiaceae, they possesses both DNA and RNA. So, ibig sabihin, they are genetically complete organism unlike virus. They divide by binary fission. So, yung binary fission, alam natin na starts from 1, then it's divided to 2 until it goes on. So, kaya mabilis yung pag-multiple or pagkalat niya inside the host body. Next naman natin is for culture method. So, Rickettsiacea is they grow on the cytoplasm. So, we have culture methods, yolk sac. So, dito, gumagamit sila ng 5 to 6 days old na chick embryo. Tapos, ini-inject sa loob yung bacteria ng Rickettsiacea. And they multiply in south of membrane surrounding yolk sac. So, yung parang yolk sac or yung culture method na yolk sac or yung itlog is nagsuserve as yung host niya. So, dun nagmumultiply itong bacteria na Rickettsiacea. Question. Sabi ko kanina na bakit yung bacteria Rickettsiacea is namamatay pag outside the host. Paano siya nalilipat? So, si Rickettsiacea, meron pa rin naman siyang ability para mabuhay ng longer, para mailipat sa other host. So, ang ginagawa nilang ng mga scientists dito is, they transfer quickly yung bacteria para hindi siya mamatay. Kasi, later on, malalaman natin na super sensitive talaga ng ibang species na under Rickettsiacea. Number 2 is cell cultures. They grow in many continuous cell lines as HeLa, HEP2, Detriot 6, mouse fibroblasts, but are not satisfactory of primary insulation. So, mahirap sila in insulation. So, they also grow on non-metabolizing cells. So, mas gusto nila yung parang mga tamad na cells kaysa sa mga metabolizing cells. Next is animal inoculation. So, dito sa animal inoculation is gumagamit lang sila ng guinea pigs and mice para yun yung mag-serve as their host. Tapos, doon multiply yung bacteria. So, dito ini-inject nila sa mice or dun sa guinea pig yung bacteria. Then, dun na mag-multiply sa loob. So, the mice and the guinea pigs serves as their host. And yung magbibigay sa kanila ng life kasi they are intracellular obligate parasites. So, next is the factors affecting the survival of Rickettsiacea. So, number 1, both Rickettsiacea and Orientia cannot survive longer outside the vector host. So, yun nga sinabi ko kanina, they depend on their host and their vector para mabuhay sila because they are obligate intracellular parasites. They are quickly destroyed by heat, drying, and disinfectants such as hypochlorites, ethanol, 1% Lysol, and 2% formalin. So, they are super sensitive kasi mabilis lang talaga sila mamatay when they are in heat or they dried or pag gumamit ka ng disinfectants. Next is dried feces of infected lice may contain infectious form for months at room temperature. So, if yung mga lice, nagko-contain sila nitong bacteria, then may dried feces sila, yung dried feces na yun can infect pa din someone or nagko-contain pa rin siya ng infection. So, it's like chismis na akala mo na parang kahit matagal na is andyan pa din siya or kaya niya pa din kumalat. Then, as I said earlier, si Coachella may survive pasteurization and in dried milk for months. So, siya yung super strong talaga na super highly resistant niya among the 4 species na pinaliwanag ko kanina. Next, let's explain how the Rickettsiacea and Orientia affect the human being. So, ito yung flowchart. So, first, it enters the body through kagat ng arthropods or pwede yung infected feces ng arthropods. Then, hindi sila agad kakalat sa loob ng body mo. So, ang gagawin nila is magtatago sila sa endothelial cells of small blood vessels. Tapos, dun sila mag-multiply. When they multiply na super enough na para kumalat, pupunta na sila sa blood. Then, dun na mag-i-start yung pag-spread nila in the body. So, pag na-spread na, it damage vascular endothelium. So, pag na-damage yung vascular endothelium, yung blood vessels mo is pwede silang maging leaky. So, next, dahil nga sa dissemination of this, or dissemination, or yung nag-cause na siya ng infection na ganyan. So, naging leaky na. So, yung mga leaky blood, yung sa leaky blood cells, pwede siyang magka-cause ng blood clots. So, yun yung parang pinaka-process niya dahil dun sa ginawa niyang or pag-damage siya ng vascular endothelium magkakakause siya ng mga coagulation or clotting in your body. let's now proceed to the disease development that caused by Rickettsia and Orientia, or the Rickettsiacea. So number one is the typhus fever. So these diseases are transmitted by lice or fleas. Symptoms includes high fever, chills, headaches, rash, and severe muscle pain. In untreated cases, and complications such as delirium, hypotension, and multi-organ failure. So, itong typhus fever starts from a lice or flea. So, parang kinagat ka ng lice or flea na meron nitong, nagdadala nitong bacteria na Rickettsiacea. So, magkakaroon ka ng typhus fever. So, kita dito sa PowerPoint na ito yung mga symptoms niya. And also, if naging mas malala or hindi nagamot ng agad-agad itong typhus fever, pwede siyang magkaroon ng delirium, hypotension, and multi-organ failure. So, imagine yung super liit na kagat lang ng lice or flea is pwedeng makasira ng organs mo. Next is spotted fever. This is transmitted by tick bites. It is characterized by fever, rash, open starting on wrist and ankles, then spreading. Headaches, nausea, and muscle pain are other symptoms. They have, if severe cases are involved, vascular damage, organ dysfunction, and high mortality if untreated. So itong si spotted fever, that is also caused by the bacteria Rickettsiacea, is transmitted by also tick bites. And if meron ka nitong spotted fever, is nag-i-start yung rash mo on the wrist hanggang sa mag-spread siya. So, magkakaroon ka din ng headaches, nausea, and muscle pain. So, pag hindi na gamot ito agad-agad, pwede mo rin siyang ikamatay. So, yung super small na bite ng tick na nag-carry nitong si bacteria Rickettsiacea is pwede mong ikamatay. Next is this scrub typhus. Ito yung caused by Otsutsugamushi or the Orientia. So it is transmitted by larval mites, chiggers. It is present with fevers, chills, headaches, rash, and often an eschar or the black scab dito sa picture. And complications may include pneumonia, encephalitis, and circulatory failure if untreated. So, yung super liit na bite ng chigger is magkakaroon ka na nga ng scar dun sa bite area mo, and can also cause pneumonia, encephalitis, and circulatory failure. So yung mga mites pala, or yung mga super liit na mga nakikita natin from our mga animals, is nakakakos ng pwedeng kamatayan. Yung black scab or this bite site, yun yung eschar. Next is the Q fever, or yung pinakamalala sa lahat, and it is caused by Coxiella. It is transmitted by inhalation of aerosols. So sabi ko nga kanina, is Coxiella is transmitted by aerosols at hindi siya from bite marks. So from infected animals and products. It is characterized by high fever, chills, headaches, pneumonia, and hepatitis. So ito yung parang picture ng severe case ng Q fever na nakita ko in Google or in internet. Chronic cases may cause endocarditis. So itong si Q fever pala is pag lumala siya ng lumala, I've read din na pag lumala siya ng lumala, maapektuhan niya din yung liver mo and yung lungs mo. So for methods of detection naman of Rickettsiacea, we have direct detection of antigen. So we can detect their antigens directly. Nucleic acid detection. So dito parang pag-aaralan yung DNA or RNA of the bacteria. Isolation. So we can use the animal inoculation or yolk-sac. So kukunin yung bacteria or species, then i-insert siya into a guinea pig or mice or in a yolk-sac. Serological methods like whale Felix test or a specific test using rickettsial antigens. Or these are the treatments naman that can help on treating the diseases that is caused by Rickettsiacea. So number one, never use sulfonamide. Kasi sulfonamide, pinapa-enhance niya lang or ina-enhance niya lang yung severity ng disease. So, parang imbes na ginagamot niya yung disease na binigay nitong si bacteria Rickettsiacea is mas pinapalala niya lang ito. It can worsen it. Their use can worsen clinical outcomes in rickettsial infection. So, never use sulfonamide. Next is the very advisable na tinitake ng mga patients na meron nito is the tetracyclines, especially is the doxycycline. So, it is the drug of choice for treating rickettsial infections. They inhibit the bacterial protein. So, in-inhibit nila itong protein synthesis. So, in-inhibit nila yung protein synthesis ni Rickettsiacea, leading to rapid clinical improvement. So, mas mabilis yung paggaling ng mga patients na meron nitong bacteria na to. And yung isa sa parang sinasuggest or binibigay or nire-reseta is the doxycycline. It is highly effective and usually prescribed for both adults and children para sa mabilis ang paggaling. And meron naman tayong alternative na treatment which is the ciprofloxacin. It is a fluoroquinolone antibiotic that targets bacterial DNA replication. So, itong si ciprofloxacin as tinatarget niya yung bacterial DNA replication. So, parang in-inhibit niya din. But, ciprofloxacin is hindi siya ganun ka-effective na gamot kay tetracycline. So, tetracycline talagang mabilis yung paggaling mo. While si ciprofloxacin is alternative if wala sila nung tetracycline or yung doxycycline. So, ito yung mga nito. And let's now proceed to the bacteria Bartonellaceae or si Margaret Monjamon Bartonellaceae. Charot. Joke lang yun. So, let's define it first. Bartonellaceae are tiny gram-negative bacilli, usually transmitted by arthropods and invade endothelial cells and blood cells. So, itong si Bartonellaceae is malapit lang talaga siya kay Rickettsiacea kasi it is also transmitted by arthropods which are the tick, mites, fleas, mga ganon. Pero dito kay Bartonellaceae, it invades endothelial cells and the blood cells. So, ang common or yung pinaka kilala na human pathogens are the B. bacilliformis, B. quintana, and B. henselae. Ito yung itsura niya under the microscope. Then, proceeding to these human pathogens. First is the B. bacilliformis. So, B. bacilliformis causes Oroya fever that is transmitted by sandflies. So, clinical features nito or yung symptoms niya is meron kang fever, hepatosplenomegaly, hemorrhage in lymph nodes, and progressive anemia. So, ito yung picture niya under the microscope and ito yung picture ng Oroya fever or yung kinakos niya na infection. So, laboratory diagnosis is demonstration can be done by blood smear stained by Games stain. So, for the diagnosis nito is ginagamit yung Games stain. Ito yung picture niya. Tapos, yun yung parang bacteria na under the microscope which is the bacilliformis. For the prevention method is in bacilliformis or yung sa Oroya fever is they use chloramphenicol na gamot and these are the prevention methods. Yung gamot na yun is to inhibit or to para magamot nga yung binibigay na infection ni bacteria B. bacilliformis. So, prevention, first is the vector control. So, protect against sandfly bites. Gumamit ka ng insect repellents or insecticide, mag-spray na ganyan. And number 2 is environmental measures. Reduce sandflies breeding sites near home. So, wag kang titira sa lugar na madami nagbe-breed ng sandflies. Kasi talagang makakagat ka dun. And early detection and treatment. If meron ka na nitong si bacilliformis, so magpa-diagnose ka na para matgamot na siya agad or for antibiotic therapy and to reduce the transmission. For next one is we have B. quintana. So, B. quintana causes trench fever or 5 days fever. So, fun fact, this this trench fever or the 5 days fever is from World War II. So, dito parang yung mga soldiers is nagkaroon sila ng syempre, wala masyadong ligo noon. So, nagkaroon sila nitong trench fever or 5 days fever na caused by the bacteria Liquintana. So, it is exclusively a human disease without animal reservoir. It is transmitted by body lice when infected feces are rubbed into the skin. So, yung parang yung mga lice is, hindi siya hair lice. So, it is body lice talaga. Syempre, ito lang, nagkakaroon lang nito is yung mga, mga tao talaga na walang hygiene or walang proper hygiene. So, yung body lice is meron silang infected feces of B. quintana. Tapos, na-rub siya sa skin nila. So, nagkaroon sila ng trench fever or the 5 days fever. So, ang symptoms or the clinical features are fever, headaches, malaise, rash on chest, abdomen, or back. Infection is mild, has a slow course, and prolonged convalescence. So, in culture naman, it can be grown on blood agar. So, differs from Rickettsiacea. In laboratory diagnosis, they use PCR. So, next is the prevention method. So, ang ginagamit na gamot dito is the doxycycline, the chlorophenicol, and yung alternative dito is the azithromycin para magamot yung trench fever that is caused by the B. quintana na bacteria. So, prevention. Paano mo maiwasan to? Number 1, personal hygiene. Kasi paano ka magkakaroon ng body lice kung may proper hygiene ka? Maintain good body hygiene to prevent body lice infection. Number 2 is clothing and care. Wash and boil your clothes, bedding, and personal items to kill the lice. Kasi sa body mo yun. Then, public health measures. Improve the sanitation, syempre, and living condition. Syempre, kung nakatira ka naman sa lugar na super dirty talaga, di talagang hindi maganda yung hygiene mo, magkakaroon ka pa ng body lice na meron pang B. quintana at magkakaroon ka ng trench fever. Then, screening and treatment. If meron ka na ng parang symptoms, identify and treat cases early para ma-stop yung spread niya. So, yan. Lastly, for the last bacteria is the B. henselae. It causes cat scratch disease. So, from the word itself, cat scratch, galing siya sa cats. Results from contact, scratch, or bite of infected cat. Clinical features. So, itong si cat scratch disease is nakukuha siya sa mga pusa or sa mga stray cats na infected with B. henselae. So, parang nakakakuha ka nito if meron kang contact from them in their bite, tapos nakagat ka nila and scratch. So, syempre yung iba, hindi naman natin alam, lalo yung stray cats, hindi naman natin alam if they are infected or not. So, always be careful. So, for clinical features, cervical and axillary lymphadenopathy, vascular nodule on skin and mucosa. So, parang meron ka ng mga, parang sa picture, meron kang mga bukol-bukol. Then, yung disease na ito is severe from mga tao na sa mga tao na merong HIV. So, mas delikado to. Kaya dapat malakas yung immune system mo or yung mga tao na may mababang immune system. So, for their culture method, they can be done by using chocolate agar and Columbia agar. So, in laboratory diagnosis naman is the lymph node biopsy shows bacilli on Wharton's starry silver impregnation, and disease is self-limited and does not usually need therapy. So, yung disease is parang kaya niyang mag-heal on its own. Pero if severe cases, kailangan mo na magpagamot. So, B. henselae prevention. So, sabi ko kanina is it is yung kadalasan mabilis siyang gumaling lang. For prevention, or kaya niyang gumaling on its own. For prevention naman, animal handling, avoid rough play with cats, especially kittens, to reduce risk of bites and scratches. So, kahit na love mo yung cats, kailangan mo pa rin mag-ingat sa pag-handle sa kanila, or huwag ka masyadong maglaro ng talagang super rough play or talagang nagkakakos na ng scratch. Won't care. If na-scratch ka naman ng pusa or nakagat ka, magpa-check na or maglinisan mo na agad yun. Huwag mo nang hintayin na dumugo pa ng tumugo hanggang sa mag-heal na lang nang hindi mo pa nalilinisan. So, wash it or clean it immediately with soap and water. Then, veterinary care. So, syempre, hindi lang naman ikaw yung kailangan mag-ingat or magpa-check. Kailangan mo din ipa-check yung cat. Kailangan mo din siyang ipa-full vaccine para healthy and free from fleas na pwedeng fleas can also carry this bacteria. So, for immunocompromised individuals naman or yung mga mababa immune system, they should avoid contact with stray or sick cats kasi yung mga stray or sick cats are mostly na nagkakaroon nitong si bacteria na B. henselae. So, sinabi ko nga kanina na diba it is self-limited na infection, kaya niyang mag-heal on its own. Pero, on some cases is nagre-reseta pa din ng gamot, which is parang kanina dun sa B. quintana, yung azithromycin. Yun yung parang gamot na nire-reseta sa kanila. So, this is the end of my presentation. Thank you for listening. I hope that you guys got something on my presentation. At sana napakilala ko ng maayos sa inyo ang family ni Rickettsiacea and ni Bartonellaceae. So, thank you.